Hello and welcome to Healthcare Authority's Module 2 training on Medicaid Suspension Funding Opportunities. The topics for this presentation include a background overview, funding opportunities, Medicaid Administrative Claiming, MAC, jail services, criminal justice treatment account, CJTA, 0.1%, an interview with Snohomish County, and resources. Background. Stemmed from Senate Bill 6430, suspension of Medicaid coverage allows an individual in a jail or institution for mental diseases to remain enrolled in Medicaid in a suspended status and maintain eligibility for Medicaid coverage, but with suspended benefits with the exception of qualifying inpatient hospitalization events. When an individual re-enters the community, full-scope Medicaid coverage is then restored without the need for a new eligibility determination. Funding opportunities. During this presentation, we will discuss funding opportunity options for those who assist justice-involved individuals. We have Medicaid Administrative Claiming, MAC, jail services, criminal justice treatment account, CJTA, and 0.1%. Medicaid Administrative Claiming. A funding resource we have here is the Medicaid Administrative Claiming. This program can assist with information on how individuals can apply for Apple Health coverage, explain details on the program, and assist with obtaining services for the justice-involved individual needs. A cost allocation plan must be developed and approved by the Centers for Medicare and Medicaid Services. The cost allocation plan describes how we will administer the program and ensure the federal funds are monitored and distributed appropriately. Listed here, we have some of the existing MAC programs to find out more information. Listed here are the MAC requirements. If you'd like to consider it as your funding resource, go to the link displayed on this slide for more information. Jail services. What are jail services? Today, some regions will have managed care organizations as well as behavioral health organizations. Both should provide the same service. In time, they will be phased out, and the administrative services organizations will be found in the fully integrated managed care module that will be in effect for 2019 and forward and get the non-Medicaid dollars. Jail-based services are intended to link individuals with appropriate community services to increase the likelihood of a successful re-entry into the program. The goal is that physical and mental health issues are addressed to serve the person as a whole. Some of the activities that the BHO-ASO can provide are listed here. For example, they can do evaluations for mental health and/or substance abuse treatment, pre-release services and case management, and coordinate access to primary care, housing, employment, education, and job training. Each BHO-ASO region will have a different process to access these services. Depending on the needs of each region, it may differ than the neighboring county. Criminal Justice Treatment Account. The Criminal Justice Treatment Account, CJTA, was created in 2002 to increase the use of effective substance abuse treatment for defendants and offenders in Washington State. It uses state and local resources to reduce recidivism and increase the chances that defendants and offenders will become productive and successful in the community. CJTA is a state-funded account, and the money can be spent on either substance abuse treatment and treatment support services for offenders with an addiction or a substance abuse problem, and drug and alcohol treatment and support services within a drug court. For more information, see the RCW listed here. The requirements for CJTA include: the individual would benefit from substance use disorder treatment, has not previously been convicted of a serious offense, violent offense, or sex offense, and the individual is not currently charged with or convicted of an offense that involved a firearm, caused substantial bodily harm or death to another person. If your facility is not engaged with your local BHO/ASO, please refer to this resource list that is subject to change. And for more information, please visit the link that is listed on this slide. One-tenth of 1%. By state law, counties with populations more than 800,000 individuals and cities with populations more than 30,000 can elect to use 1/10 of 1% of every tax dollar for treatment services. To learn more about the terms for the sales and use tax for chemical dependency or mental health treatment services or therapeutic courts, please see the RCW listed on this slide. Covered services under the 1/10 of 1% can include components of a coordinated chemical dependency or mental health treatment program, and services listed here but not limited to treatment services, case management, transportation, housing. If your county is not utilizing the 1/10 of 1% source, talk to your county commissioners to develop a plan. For more information on how your county can participate, visit the link on this slide. Snohomish County. Snohomish County is an example of a county who used available resources to improve health and safety in their community. In 2010, they found they were the second highest within the state of death rate overdoses. In 2013 alone, heroin and prescription opioid overdoses represented 2/3 of the 130 accidental overdose deaths in the county. According to a statement by Sheriff Ty Trenary, he said, "They realized they could not arrest their way out of the opioid epidemic." Snohomish found it took leadership, collaborative partnerships, communication, accountability, and trust to overcome the county's opioid epidemic and the terrible impact it has on our communities. They found when they started having conversations about the community needs, more people joined in. In 2009, the 1/10 of 1% tax was passed. Process of enrolling justice-involved individuals in Medicaid begun, as well as working with the managed care organizations. Some of the challenges met was while coordinating treatment for the justice-involved individual prior to their release, there were times where additional charges were added and therefore the individuals would be transferred to another facility, or the release date was not known. For more information about Snohomish County project, visit their website listed on this slide. Resources. Here are some additional resource information. Listed here, we have the Healthcare Authority Training and Education resource, Volunteer Assister if you would like to become a volunteer assister for your facility. For more information about Medicaid, please visit our Medicaid Suspension webpage. We have Behavioral Health and Recovery, and finally, Healthier Washington. For more information about Medicaid suspension, please visit our webpage. And if you have any questions, please email us at medicaidsuspension@hca.wa.gov. Thank you.